Navigating genetic risk. 9 essential questions for your next heart health checkup. If heart disease runs in your family, your medical history is more than just a collection of facts. It is a roadmap for your future health. Genetics can significantly influence your cardiovascular trajectory, often independently of how well you eat or how much you exercise. Medical experts emphasize that a family history of early cardiac events, such as a parent or sibling suffering a heart attack or sudden cardiac arrest before age 50, can double your personal risk. Because these risks are often silent, proactive communication with your physician is vital. To help you move from passive observation to active prevention, here are 9 critical questions to guide your next medical consultation. Understanding your unique risk profile. How does my family history affect my lifetime risk? Not all family histories are created equal. A history of hypertension, high blood pressure, may predispose you to high blood pressure, but it doesn't always mean you are at a higher risk for coronary artery disease. However, a history of early heart attacks is a much more direct indicator of danger. Understanding the specific nature of your family's history helps your doctor tailor a prevention plan. Should my children be screened? If you have been diagnosed with high cholesterol, the risk may be hereditary. Doctors suggest that children as young as 2 years old may need screening if a parent has high cholesterol. This is particularly important for detecting familial hypercholesterolemia, a genetic condition that causes extremely high, bad cholesterol levels, increasing the risk of early stroke or heart attack. Would I benefit from a calcium scoring (CAC) test? A CAC test is a low-radiation CT scan that looks for calcified plaque in your heart's blood vessels. For those over 35 with a strong family history, this test provides a snapshot of actual damage. Finding plaque in a relatively young person can trigger early interventions, such as statin or aspirin therapy. Should I get a lipoprotein A, LPA test? LPA is a specific type of sticky cholesterol particle that contributes to plaque buildup. Many patients are unaware this test exists, but it is a crucial risk enhancer. Experts recommend measuring it at least once in a lifetime, especially if male relatives had cardiac events before 55 or female relatives before 65. Beyond cholesterol, managing comorbidities. Should I take a daily aspirin? Warning: do not self-medicate. While daily low-dose aspirin was once a standard recommendation, medical consensus has shifted. Aspirin can be beneficial for specific individuals, but it carries risks. Always consult your doctor to determine if your specific profile warrants aspirin therapy. Does my kidney disease or inflammatory condition affect my heart risk? Heart health does not exist in a vacuum. According to the American Heart Association, chronic kidney disease, CKD, specifically stage 3 or higher, is a significant risk enhancer for coronary artery disease. Similarly, inflammatory conditions like lupus or rheumatoid arthritis can increase cardiovascular risk, often requiring more aggressive management of cholesterol levels. Lifestyle, genetics, and technology. I am fit and eat well. Am I still at risk? Yes. You can have a healthy body mass index, BMI, and perfect blood pressure, yet still possess genetic markers for high cholesterol. If your cholesterol is elevated due to genetics, lifestyle changes alone may not be enough. Medication may be necessary to reach safe levels. Should I pursue genetic testing? While there isn't a single test for heart disease, there is specific screening for familial hypercholesterolemia. If your LDL, bad, cholesterol levels are exceptionally high, over 190, doctors often recommend genetic testing to confirm if the cause is hereditary. Which heart health trackers should I use? Rather than getting lost in a sea of gadgets, ask your doctor what data is most useful for your condition. For hypertension, an at-home blood pressure monitor is invaluable. For general fitness, a step tracker or smartwatch can help maintain activity levels. The bottom line: a family history of heart disease is a powerful predictor of health, but it is not a destiny. By asking targeted questions about specific tests like LPA and calcium scoring, and by recognizing how other conditions like kidney disease impact your heart, you can transition from reacting to illness to actively managing your longevity.